Now let's go to diagnosis according to pathogenic Qi. Xuehai stagnation, part 2. The heart has the function of governing blood. The heart can easily be affected by blood stagnation, which will manifest as a sharp pain in the chest and a disturbance of the cardiac rhythm. Stagnated blood does not have any of the nourishing qualities of blood. On the contrary, blood stagnation blocks fresh, nutritious blood from circulating through an area. This can result in the skin above an area where there's stagnated blood being dry, flaking, or thickened. There may also be changes in skin pigmentation. By blocking the circulation of blood in area, blood stagnation will prevent Shen, which is anchored by and thereby circulates together with blood, from flowing through the area. This can result in a sensation of numbness. This is typically seen when there is scar tissue. The stagnated blood from the trauma or the operation will have accumulated in the tissue around the operation site or the injured area. The tissue is often hard and thickened, and there is either numbness or sensory disturbance in the area, all of which are characteristics of blood stagnation. Stagnated blood moves more slowly, if at all, and is therefore less oxygenated. This can be seen in generalized signs such as a dark facial complexion, dark lips, dark or purple nails, purple tongue, and swollen veins on the underside of the tongue. Wherever there is tissue, skin, or blood vessels that are purple in color, this is a sign of blood stagnation. Typical examples of this are bruising, varicose veins, and spider nevi, but it could also be the tissue around the joint. The pulse can be choppy, wiry, or confined where there is blood stagnation. It can also be knotted if there is heat blood stagnation. On the mental emotional level, blood stagnation can impede the movement of Shen. This may mean that the person is psychotic, depressed, or has difficulty staying awake. The symptoms and signs are sharp pain that is localized in one place, pain that is sharp, piercing, or stabbing, pain that is worse at night or after the person has been physically inactive, limited or stiff movements, bleeding, long menstrual cycle, painful menstrual bleeding, dark and clotted menstrual blood, sharp chest pains, irregular cardiac rhythm, dark facial complexion, altered pigmentation, dark lips, dark nails, rough and flaky, thickened or dry skin, physical lumps and knots in the body's tissue, numbness or sensory disturbances, purple skin, purple blood vessels, depression, and the ear is tender or painful when it is bent, doubled, and squeezed. Purple or dusky tongue, swollen purple sublingual veins, choppy, wiry, and confined or knotted pulse. The key symptoms: sharp, piercing, or stabbing pain, limited or stiff movements, dark lips, swollen, purple sublingual veins. Treatment principle: circulate blood and disperse blood stagnation. Acupuncture points to choose from are UB17, spleen 6, spleen 10, and Jingwell points and local points. A needling technique to be used is draining. Bleed Jingwell points and small purple vessels in the skin. The use of cupping, moxa, guasha, and 7-star needles is also relevant. Explanation is UB17, spleen 6, and spleen 10 move blood in general. Jingwell points activate blood in their own channel when they are bled. And bleeding spider nevi and stagnated blood vessels disperse blood stagnation in the local area. Relevant advice. As with phlegm, it is vital that the underlying pattern that has been involved in the creation of blood stagnation is addressed. Blood stagnation can prevent the circulation of Wei Qi in an area where there has been a physical trauma. It is therefore important that this area is protected from the environment, so wind, cold, and dampness cannot invade the area. It is typical that joints that have been injured or operated are often sensitive to changes in the weather. Physical activity is beneficial because it will circulate qi and blood, but it's also important not to overburden the area or force a joint to move more than it will. A joint or a limb should not be forced to move beyond the spot where there is a sharp pain, because doing so may cause further blood stagnation. Blood stagnation can be caused by the following patterns of imbalance. There's qi stagnation, phlegm, blood deficiency, qi deficiency, cold, heat. And the blood stagnation can result in the following patterns: qi stagnation, heat, phlegm, and blood deficiency. Thank you for your attention.